Good afternoon. This is NHS Crisis, Your Say. Today, Sky News is launching a year-long project with analysis from two leading think tanks to find solutions to this crisis that is gripping our National Health Service. And this afternoon, we are taking your calls. We want to hear from you. It's a real chance to share your views about what is happening to the health service. Before we get into your calls, plenty of you lining up to speak to us. I just want to introduce you to our guests that will be with us for the duration of the afternoon. We have Roy Lilly with us, health policy analyst and former vice chairman of West Surrey and North East Hampshire Health Authority. Alongside Roy this afternoon, Dr. Ellie Cannon, GP and author. Welcome to you both. Don't forget the number to call today if you want to speak to us here in the studio, 0208 167 2200. There'll be plenty of reminders of that number on the screen throughout the programme for you here on Sky News today. Right, let's hear from you. First on the line today, we have Victoria from Horsham. We're going to be talking in this section about waiting times in the health service and the experience you have if you are able to see one, if you're able to get access to treatment. Victoria in West Sussex, his father died in hospital after waiting 5 months to be discharged. And Victoria, thank you so much for calling in to speak to us here this afternoon. Talk to me about what happened to your dad.
Initially, it was about 7th of August. I sort of went to his flat and found him in a bit of a state. So I called 999 and they were there literally within half an hour. So, you know, that was a great positive. They looked after him. They took him to hospital. And he had some stomach gastric infection that was causing him to be quite poorly. So they kind of gave him antibiotics and fluids, and that was all okay. And then I was told, you know, your dad can go home, but he is quite frail, so he would need some sort of care package to go home with. And that never came. And this went on, and then he kind of got COVID a couple of times. He'd never had it before. He'd always been really careful, so that was disappointing. And then he got over that and again was ready to go home again, and then again, no care package. And then just before New Year's, he got like a proper flu. So he was isolated into a sort of separate room. We could still go and visit. We did sort of usual PPE and everything. And then the flu went to his chest. He got a chest infection, and sort of the first week of Jan, he developed pneumonia. And he passed away on the 6th of Jan from pneumonia.
Oh, well, Victoria, first of all, I'm so sorry for your loss. But just listening to all of that, your father was waiting for 5 months to be discharged from hospital. He originally went in with stomach problems.
Correct.
And then he died in hospital from unrelated matters, from what you've been saying.
Yeah.
Talk to me about how that happened. You mentioned a care package and that wasn't able to be put in place. Now, I know what a lot of people may say to you, Victoria, just out of curiosity. You know, your father clearly had family, he had you. He may have had other members of family. Why couldn't he go home? What kind of care did he need and wasn't being given by the NHS that made him stay in hospital for 5 months?
He needed very sort of intimate personal care. So he'd lost control of his bowel after having this gastric infection. So he was wearing sort of incontinence pads, sort of like almost like nappies, really. And he also had got very frail. He had a lot of muscle wastage while he was in hospital. He was having some kidney problems as well. He was kind of waiting to see his kidney doctor all this time. So they were desperate to get him home. So because there were other symptoms, he was quite anemic. There was other problems, just things that, you know, unless you've got specific medical training, it's not something that just a family member could pick up. And he needed sort of care with everything, you know, getting up, his personal care, washing. Where he lived wasn't really suitable, so that was another thing. But they couldn't get him moved somewhere more suitable until he was home, and then he could be assessed. So everything was kind of pinned on him getting home with the care package, and he then would have been moved to they call it like an extra care scheme, where they have nurses on site that live there. They have walk-in wet rooms, so his bathing would have been easy. He could have done that himself, but where he lived, he would have needed help with pretty much everything. I work full-time. I've got 2 children, so unfortunately I wasn't able to, you know, give up work to kind of give him that care. And there's also, you know, there's just things that I'm not medically trained to do. So I didn't really feel like I could have provided that for him. So he was ready to go home. You know, I think it must have been about 4 times I got the call to say, oh, Dad can go home. but we need to wait for the care package because he does need care probably 3 times a day with his bathing just before bed, and also to come and sort of help him do some food. I could have done the lunchtime just to give him some food, but the other personal care, I just wasn't able to do that.
Yeah, no, Victoria, it's important to say that because obviously that is something that's said a lot when people say, well, why do you need a care package? You have a family that can look after you, and you've given us the bigger picture. It is not that simple. Ellie and Roy, you were nodding along to what Victoria was saying there. And Roy, I think you whispered to Ellie, we hear this a lot. This is a common problem.
It is. And Victoria, I'm so sorry to hear that story, but it encapsulates really the problems that we're facing now. And the NHS did its bit as much as it could. And then, of course, it can't look after people when they're in their own homes. That's the difficulty that we've got. Yeah. And so we look to our partners in care, which are organised by social services. What you were wanting was a package from domiciliary care. Domiciliary care and the care sector generally has about 160,000 vacancies at the moment. And getting the care packages in place is super difficult. And that means then, of course, that person is in bed in a hospital for much longer than they need to be. Something called deconditioning takes place where they get worse.
It makes you vulnerable to things like flu and
exactly.
COVID.
And as much as the hospitals try to avoid that sort of cross-contamination, it's really very, very difficult. And at the heart of this, at the heart of most of the problems that I'm sure we're going to hear about this afternoon, is the Victoria example where actually what we need to fix is social care. And I'm sure Ellie sees that every day in her practice.
Yeah, in your practice, you must hear that a lot from families who, you know, you're a first port of call as a GP, then that patient may go into hospital. And, you know, people always say it's difficult to get into hospital, it's difficult to get into GP, but actually it's difficult to get out of hospital.
Absolutely right. And people talk now about patient flow, so flowing from primary care with me through an ambulance, through a hospital and out the other side. And it's out the other side, as Victoria's described, into social care that is causing such a problem with people. And it's incredibly upsetting as well from the human point of view that this was, you know, the end of your dad's life, Victoria. And I'm so sorry that that's sort of how everything played out. And as Roy said, you know, hospital itself is not a good place for people to be. It's great when you're acutely unwell. And my hospital colleagues sort people out, but then to sit there and not to have family around and deconditioning, as Roy said, allows, unfortunately, this very sad end-of-life situation to play out. And what I think we'll also hear this afternoon as well is this story could have been different in another part of the country. We have a postcode lottery. There could have been a different social care issue somewhere else. There may have had better staff. And actually, it's not a homogenous system, and this didn't have to happen.
Yeah, Victoria, thank you so much for speaking up for your family, your dad and other families like you who are going through the same thing in the National Health Service. Anastasia from Leeds is on the line now. Anastasia has cerebral palsy. And Anastasia, you've been on the NHS waiting list for nearly 3 years for treatment.
That is absolutely correct. And I feel absolutely infuriated. I feel like I'm losing the will to live, to coin a phrase. I mean, as you said, I've got cerebral palsy, but what I'm concerned about is that I've got this, I will say it because it puts it in context, I have it's not easy to say, but I have a urological condition and I just want it fixed. And I'm not receiving any social care. I'm not receiving any support. Unfortunately, I come from a care background through no fault of my own, because my mother put me in an institution at the age of 2 weeks old, and so the support isn't there. I have to fight always myself. And in fact, I was once called up for the appointment, because I will say that Botox isn't only for, as you know, it's not only for cosmetic reasons, and to have this procedure. And a second time, and they said, "Oh, we didn't realise that you have cerebral palsy." So they don't actually get their act together. We need joined up thinking. It varies. I've lived in many areas in different areas throughout the country. It all often depends on who you speak to, and I don't feel listened to. When it comes to social care, it depends on whether somebody has the ability to do the assessment or not. And even if you do have an assessment, then you don't necessarily get your needs met. So I don't know what to do. And what worries me is the fact that the situation for me and for others can actually get worse. I believe that my condition is getting worse and worse and worse.
And Anastasia, I can hear how upset you are. I just want to go to Dr. Ellie on this point because, look, Anastasia is at her wit's end, waiting 3 years for treatment, which will be, no doubt, Anastasia, correct me if I'm wrong, classed as non-urgent. I mean, there are 6 million people currently waiting for treatment in the UK. Anastasia making up that number. What advice would you give to Anastasia? Because she doesn't feel like she's getting any support, any help.
I would say it is urgent. I mean, I'm not...
I'm sorry, Anastasia. I meant by the NHS they would class it as non-urgent, but of course it's urgent to you. It's affecting your life.
So I would say a couple of things. I mean, first of all, speak to your GP and make sure the referral has gone through. I know that sounds ridiculous, but we're all human and we're relying on sort of technology as well, and sometimes referrals don't go through. So definitely make sure, see what your GP can do in terms of the referral. The other thing is speak to PALS, who are the patient advocacy service within hospitals, and see what's happening with your appointment, and see if you can make sure, because obviously, as you've rightly said, this isn't just a health problem that needs fixing. This is a health problem that needs fixing that then affects your employment, your quality of life, what care package you need. And actually, if this was sorted out, then you would probably need less help from elsewhere.
Yeah.
Exactly.
This is a system problem. And, we call them interfaces where one bit of the service joins up to the next bit. And it's like people trip over the joins in the paving stones on the patio. They trip over the joins in the services as well. And it's so often that you get these service interfaces that let you down.
Yeah. OK, let's bring in Anil from Birmingham, who's on the line, who is a big fan of the NHS and is disappointed that it's got to this place. Anil, tell me what you want to say today.
Well, basically, I feel the institution itself is absolutely magnificent. Most countries are jealous of NHS. And the present government, for the last 12 years, has not funded it enough, because it seems as if they want to break the system up and privatize. And privatization just means shareholders make money instead of the NHS serving the people. Look what's happened in the USA. I was involved in surgery. First, in 2008, I had a heart attack, and the treatment I received was immaculate. The ambulance got to me within 5 minutes. Okay, I had surgery last November, quite serious surgery, over my prostate, and the nurses literally worked their guts out. And to now say to them they don't deserve a pay rise, it just beggars belief that we are the 5th richest country in the world. And we can't afford to pay our nurses a salary they can live on.
If you're just joining us here on Sky News, we are discussing the state of the National Health Service NHS crisis. It's your say today. We're handing the programme over to you. Get in touch with us, 0208 167 2200, whether you work within the NHS or you've had experience recently using it, good or bad. We want to hear from you. We're exploring everything that's going on in the NHS service at the moment. That was Anil from Birmingham, who is very complimentary of the NHS and received great treatment. Let's speak to Tony from Preston. He is talking about physio appointments. The waiting times are ridiculous, Tony. Talk to me about why you need one and how long you've been waiting.
Well, I've been playing sport for over 60 years, and since 2003, I've had 3 new hips, an ankle fused, a cartilage out, and tendons done in my shoulder. And I've never waited more than a month to be seen, and never waited for more than 3 months for an operation with 4 different surgeons. I had an Achilles injury on the 3rd of October, and I'm basically struggling to walk. So I went to my doctor on the 8th of October, and I was offered a physio appointment on the 14th for the 5th of December, which was over 2 months later. I couldn't get a physio appointment at the local hospital, so I got a call with a private physio, an appointment for the 4th of December. On the 4th of December, they then said, we're cancelling your physio appointment and we can offer you another one on the 17th of February. So it's took 4 months to get an appointment, and I don't know whether that's going to go ahead. In the meantime, I needed a scan on my ankle. So I only got my scan last week, which was the 17th of January. 3 months to get a scan. It's absolutely appalling. And I'm now waiting to see a surgeon. So I rang the orthopaedics at my local hospital, and they told me it could be 2 to 3 months. And after that, I would get an appointment for an operation in either 12 to 18 months. So if I'm lucky, I'm going to get an appointment or get something done in my ankle, and it's going to take 2 years to do that. I've paid into my taxes for 57 years. I need to be active for my own sanity and mental health. It's doing me no good at home, and I'm so disappointed with the waiting list now. It's absolutely terrible.
Yeah, Tony, you won't be on your own in that 2 years to get your ankle sorted. Like you said, it's your physical health, it's also your mental health. You want to be mobile, right? You can be mobile. You're just being made to wait for 2 years. But it's actually made you go private, hasn't it?
Well, I'm seriously thinking of going private now. It's not in my principles, but I'm struggling to walk, and I just can't put up with this any longer. So, you know, when you've paid all your taxes, you should be able to get an operation like I've had for the last, 20 years, as I told you. I've had 6 operations with the NHS, and it's been absolutely superb service. But now I can't even get the scan, can't even get an appointment with a surgeon, and certainly it's going to be too long for me to get an actual operation.
Roy, why isn't someone like Tony prioritised? Because, you know, I suppose you don't want to compare ailments or, you know, anything like that, but, you know, you might look at an ankle and go, well, it's not urgent. But again, for Tony, like Anastasia said, for these people, it is urgent. It's affecting their life.
See, for everybody, it's an important thing. I mean,
why is he not getting an appointment?
you can't make a comparability, you know, between people and their troubles. I mean, Ellie, I'm sure will talk about an Achilles tendon. I mean, it sounds to me like that needs to be dealt with more urgently than just waiting for a scan. But the situation is this: the NHS is like a big production line. You know, sick and poorly people go in one end, and hopefully happy and fixed up people come out the other. And it doesn't take much to disrupt that production line, and that's what's happening here. The production line is bunged up because we've got people in hospital that we can't get home. We don't have enough staff on the wards. The NHS is still struggling with COVID. I mean, most of us think COVID's over, but it's not for the NHS. We're in the middle of a flu season, which is one of the most horrendous flu seasons I think we've seen for a long time. And of course, on top of that, we've got the disruption of the strikes. So when you get that kind of disruption in the system, it has a knock-on effect. So if you take something like a scan, if the hospital is preoccupied with scanning people who are already in hospital, who've been admitted, then there isn't the capacity. And this is a word we're going to hear a lot this afternoon. The NHS doesn't have the capacity to deal with the problems. And there's lots of reasons for that, and we'll no doubt talk about them later on. But this is a capacity issue. There should be enough headroom in the system to say to outpatients who want a scan, come in. But at the moment, the capacity is full, really, by inpatients.
Yeah, absolutely. And I'm sure you know about sort of figures for the number of physiotherapy jobs that are vacant at the moment. Now, interestingly, we've mentioned already postcode lottery. This is not a story that I would recognise as a patient journey from my practice, because where I work, we have what's called a community musculoskeletal service. So actually, people see physiotherapists very quickly. They at least speak to them very quickly. And likewise,
some are self-referral.
Absolutely. Yeah. And likewise, my patients do not wait 3 or 4 months for a scan on an Achilles. It's actually quite quick. Yes, they might wait for surgery, but the process would have been started. So again, this is back to the fact that we have areas where we have a really good gold standard of care, but there's no mechanism for other areas to learn or to copycat those services.
Yeah, Tony, like when you listen to that, you're a victim of where you live in terms of it's a postcode lottery as to how long you will wait, what care you will receive and when.
We lost him.
Is Tony still with us?
Yeah, I'm still with you, yeah.
Yeah, Tony, you know, that must be very frustrating to hear that it's a postcode lottery. Essentially, you're a victim of where you live.
Yeah, I mean, it's terrible, isn't it, when you think about it? Because, I mean, I only live 2 miles from the local hospital, so I could go anywhere to get care. I would go anywhere to get the treatment, and that's what I've had to do with my hips over the years. And obviously, it's a shortage of staff, isn't it? You know, there's no way that I can get an appointment with the physio at the local hospital, which are employed by the NHS. I mean, this private
to go into other areas for treatment. Could Tony say to his doctor, look, I'm not getting any joy with the hospital you've recommended me to. I've been on a waiting list for 2 years.
Sure,
can I go somewhere else?
Patient choice, you can choose to go somewhere else, of course you can. But what happens here, and you must see this a lot, you know, a scan is a scan. You know, it's a picture, so what's the scan for? Is it for a diagnosis? Yes, it is, okay. To diagnose what? Well, if you've got a ruptured Achilles tendon and you can't get about, then clearly that scan should take priority over a scan that's just maybe checking, I don't know, post-operative or you know, it's a way of prioritising the scans and it exists, Sarah-Jane. The difficulty we've got is the NHS is so busy at the moment, the whhole lot seems to me to have imploded.
Yeah. OK, we've been talking about waiting times, and we've also been talking a lot here on Sky News about response times, ambulance response times. Sky's Becky Johnson has been at the West Midlands Ambulance Service Control Centre for quite a few days now. She's been out and about with the teams as well. It's in Dudley. And Becky, what's happening right there right now? We keep hearing about these lengthening response times. Talk to me about your experience there in the control centre.
Well, they are still very busy. Of course, the pressures this winter have been unprecedented. We know that. But nationally, we've heard today that the waiting time at hospitals, that ambulances are having to wait before they can hand over to A&E, has fallen slightly on last month. And that's what we're seeing here at West Midlands Ambulance Service. I've got the latest numbers. Last month, in December, the longest a West Midlands Ambulance Service ambulance waited outside a hospital was 32 hours and 57 minutes. Quite extraordinary. Now, this month, the longest is 11 hours, 57 minutes. So quite an improvement. Now, I'm told there are a number of reasons for that. Firstly, they're seeing fewer cases of flu, fewer cases of COVID, and thankfully fewer poorly children with strep A. But they're also doing things in the hospitals. So speaking to the paramedics here, there are now advanced paramedic teams in some of the busier A&E departments across the Midlands who have set up essentially in spaces within those A&E units, working alongside healthcare assistants from the hospital, so that ambulances can hand over patients. And these advanced paramedics could be looking after around 12 patients at a time. So they haven't quite been admitted to hospital, but at least that ambulance can then get back out on the road, because of course the worry is that there are simply no ambulances left to respond to Category 1 calls, because they're all queuing outside hospitals. Now, they're working all the time here with the live data on the walls, and just a brief look at that. Basically, the more green there is, the better. The more red there is, the more worrying. You can see it's a bit of a mixed picture today. I've got some live data on this iPad here that's telling me that at the moment, the longest wait an ambulance has had outside a hospital, there's one ambulance at Shrewsbury Hospital that's been there at 2 hours and 16 minutes. Another ambulance at the same hospital has been there 2 hours and 10 minutes. I mean, you know, we're talking about things getting better, but better than really bad isn't necessarily good. And ambulances should be handing patients over within 15 minutes. Well, looking at this data, there are at least 6 ambulances in the West Midlands that have been waiting outside A&E departments for over an hour and are still waiting there. So still the pressure is acute, but perhaps just not quite as bad as last month.
Oh, Becky, thank you. Becky, there with a snapshot of what's going on inside the West Midlands Ambulance Service call centre. You can only imagine the pressure in that centre when they're getting calls in and they're trying to find an ambulance that's free to get to those emergency calls. Let's hear from Carol in Sheffield. She's got a good story for us. Her dad broke his leg last week. He was seen and sorted, including a trip in an ambulance, inside 5 hours. Carol, tell us more.
Yes, exactly. He's 90, bless him. He fell on the ice last Friday, And it was about 9:45 in the morning. Mum called an ambulance. I wasn't there. We don't quite remember how long the ambulance took to come, but no one was standing around saying, "Where's the ambulance? Where's the ambulance?" So that was 9:45, and about 2:30, I got a call from one of the senior nurses in Resus in the accident emergency department, and that's 2:30. That's about 5.5 hours actually, and they do live a long way away. They live 12 miles away from the hospital, so you have to add that on as well. Pardon me. He called me to say that Dad was comfortable, that he'd been treated for his pain, that he'd had all his X-rays, he'd had all his blood tests, he'd been seen obviously by the nursing staff and assessed. He'd also been seen by the accident emergency doctor, a lovely lady called Frances, and I spoke to her again as well as this nurse, and they'd already made his diagnosis. They had a preliminary care plan intended at that time, and he didn't actually go straight to the ward, but it wasn't very long until he went onto the ward. Following that, that was Friday. He had his operation on Sunday. Yes, his operation on Sunday, and all of his treatment has been absolutely brilliant. It's all gone really swimmingly. The nurses on the ward have been fabulous, and we can't praise them highly enough. And okay, in the olden days, 5.5 hours might have seemed like a long time, but let's be straight and let's give some credit where it's due to people who are still managing to do a fabulous job, because they must get very demoralised when they hear negative stories the whole time.
Yeah, 100%, Carol. People always want to talk more about the bad things than they do about the good things. That's just the nature of us as people, isn't it? But when the NHS gets it right, it is the best in the world, Roy.
It's what Ellie was saying earlier. You know, it is patchy. It's not horribly bad everywhere, and it's not super good everywhere. There are differences.
It might be good sometimes, bad at others.
I mean, this is classic. The operation was well within the NICE guidelines, and this is how it's supposed to be done. But it depends a lot. There are a lot of other factors. I mean, first of all, there's the demography of the area where the hospital is. Does it have a lot of very elderly, frail people? Like, for example, along the south coast, there's a higher incidence of elderly people there. So that makes a difference. It's where the hospital is, and you often find hospitals who are in coastal areas find it very difficult to recruit. And so that's a problem if they don't have the staff. And so there's a lot of compounding factors that sit outside the hospital that impact what happens inside the hospital. And just going back to the report we had about the ambulance service, the flu, the numbers for flu are starting to drop. And what we find with flu epidemics is they're a slow burn to start with, and then they compound, and suddenly you're swamped with people with the flu. But when it burns itself out, they drop off a cliff. So hopefully we might be seeing the end of the flu.
I mean, I would say that story we heard, I would say, and obviously I'm biased because I work within the NHS, I would say that is more common than people having... I would say that is more the norm than people having a bad experience. So in my GP surgery, we take Google reviews and NHS Choices reviews, and the majority of them are incredibly positive, both regarding the clinical staff and the administration staff. And I would say that, as you say, you know, bad news makes headlines, and people talk about sort of those issues much more. But the majority, because people working with the NHS want to do a good job, we in the main are practicing gold standard care within sort of the limited resources that we have. And I would say that in the main, we have good experiences.
No one comes to work to keep people waiting or to do a bad job.
I'm just thinking back to Tony we were speaking to from Preston, who's been waiting 2 years for that ankle scan. And the issue of fairness in terms of, we mentioned postcode lottery. How is it fair that somebody in your area, Ellie, gets 5-star treatment, great reviews on Google for the hospital or the GP surgery? Someone in Tony's area is having a terrible time, whether it's getting a GP appointment, having to go in an ambulance and waiting for hours, sitting in a corridor.
So that's partly to do with what Roy mentioned, which is really interesting, actually, about the demography of staff around the country. So I'll give you an example from my own personal life. So I work in a GP practice, which is really, really good. I'm a patient in a GP practice, which is really not good, actually. And the person within my family who's got a chronic condition, we've taken them out of that GP surgery and put them in one half a mile down the road, registered there, so we can get that person very good care. And yet the GP surgery at the bottom of my road, I don't get good care. Now, that's the same demography, it's the same area. And there is this terrible, patchy service.
It's all about shopping around and doing your research. You know, we do that in other areas of life.
People don't change doctors, you know.
that's true.
All the evidence is, if you look at the numbers, you know, once you're with a GP,
That's
you
very
stay
true.
and you just kind of put up with it.
But should it be that way? Should
No,
people be a bit more proactive?
Absolutely not. I mean, you know, we should have one of these websites where you can...
TripAdvisor.
Yeah, TripAdvisor for health. But I mean...
Well, I think more tools are becoming available for people to see how their GP is doing, whether it's league tables or reviews. Yeah. All afternoon here on Sky News, we are taking your calls and giving you the chance to share your views on the state of the National Health Service. Don't forget the number to call today if you want to have your say here with us on the show, 0208 167 2200. Right, let's get back to the calls. We're now going to talk about the ongoing strike action within the health service. No end in sight to that. More dates announced for February and March. Let's talk to Vincent. He is in Birmingham. He's a retired consultant geriatrician. And Vincent, you don't support the strikes. Tell us why.
Oh, thank you very much. Let me say that it is not that I don't support the strike, and it's not that I don't support the pay increase for the hospital workers. What I am against is the timing. I retired as a consultant geriatrician in September 2021. While I was in service, we were always complaining about inadequate remuneration for the work we do. Mm-hmm. And at that time, we were actually considering going on strike and all that. This time, I am against the timing of the strikes because the government we have now in place, the government of Rishi Sunak, is virtually a new one. Last year, we had 3 prime ministers all in one go, and he is here. So far, I'm not convinced that he is doing wrong. In fact, I am satisfied with his plan of action to revamp the NHS. And I think because they are new and because they are just settling down, we should allow them time to settle before we begin to go on strike.
Vincent, you do know what people are going to be saying at home. Some people at home are going to be saying, look, you know, Rishi Sunak might be new, but the Conservatives aren't new. They've been in power for over a decade, and we've had Prime Minister after Prime Minister promising to boost the NHS, to invest in the NHS, to bring it up to where it was. But in the last, 10 to 12 years, the NHS has deteriorated. So the government isn't new. It might be a new Prime Minister, but it's the same government.
Yeah, I agree. I do agree. But he appears to have a new sense and a new way of doing things from what he has outlined. I still think that we should give him maybe 1 year, 2 years to see how he does.
Do you think he should talk to the National Health Service workers who are striking? Because what we're hearing from those on the picket lines, and I know you don't agree with these strikes necessarily, the timing of them, but what we're hearing from those on the picket lines is that the government won't even engage with them. They won't even talk to them about their demands, not their demands, their asks, whether it be about pay or conditions. They're not engaging. Do you think Rishi Sunak, if he is shiny and new and getting to grips with it, he should sit down and talk to them, actively engage with them about pay?
Yes, I am not Rishi Sunak's spokesperson. What I understand Rishi Sunak did was to set up a peer review committee that made some recommendations, all of which he accepted. Every one of us, we are all adults, every one of us knows that this government, as it is now, doesn't have much money. The nursing staff started by requesting a pay increase of 19%. He can't, I don't think, in my knowledge, I'm not an economist, but I don't think he can give them that and give the ambulance drivers and give the border agency workers and everybody. That will lead to severe inflation in this country, and we'll know what that will amount to. That is what I'm saying. Yes, I agree. He should talk to anybody who has a reason for wanting to go on strike. He shouldn't avoid them. He should talk to every individual. That is part of his job description, I'm sure. But in terms of everybody expecting the money they are demanding in this current circumstance. I think it's a very hard ask.
Yep.
That's my impression.
I get it, Vincent. If you give in to one, you have to give in to all. Like you said, so many people on strike at the moment. We're only talking about the NHS today. You've got railway workers, teachers considering going on strike. The Environment Agency. There are so many people going on strike at the moment. I completely take your point. Give in to one, you have to give in to them all. Let's talk to Gavin from Kent. Gavin had a stroke and had an amazing experience within the NHS, and believes that the NHS staff should be paid more. Gavin, first of all, how are you? Talk to me about your experience.
I'm not too bad, thank you. Funny enough,
That's
my
good to hear.
physio's just left my house.
What was that, sorry?
I said, funny enough, the physio's just left my home about 10 minutes ago.
We caught you at the right time,
You
then.
caught me at the bang on the right time, yeah.
Yeah. Talk to me about the experience you had in hospital, then. Why are you such a big fan of the treatment you received?
Me and my wife was in London up the West End on a night out for our anniversary, our wedding anniversary. All of a sudden I started feeling ill and I went over like a tree, and she realised I was having a stroke and she phoned an ambulance. They was there in like 3 minutes. Within 20 minutes I was having care, medical care. Fortunately enough, we was right on top of the hospital. Within half an hour I was having proper care. So I had an acute stroke, but it saved my life. And then I can't say the word for it. I had to do a cranioscopy, which means they took half my skull off my head. So they done that. I don't know who's ringing me in now.
I mean, Gavin, you said it yourself. You owe the NHS your life. So for you,
I do owe me life.
Money is no object. Talk to me about some of the staff that you met and how they looked after you.
I've been in 5 hospitals.
5?
And, yeah, 5 in total. And I think Richie Sunak should go and pack an overnight bag and go in an acute stroke unit and watch how many jobs the nurses have to do in an hour. And see it with his own eyes, personally. Or one of the MPs, go in there and take a bed for the night and go and have a look. And go and live it a little bit.
Yeah. Only 25% of nursing shifts are fully staffed, according to the Royal College of Nursing. So they're working under tremendous pressure.
I mean, the nurses that I see are running around doing 5 jobs at a time. And like I said, I thank them all because I think they've been absolutely brilliant in NHS. Personally, that's my experience, and I think we should find them money and give them money.
Yeah, I mean, Gavin, you're not alone. You do hear from so many people who have had, whether it's life-saving treatment or, bringing new life into the world in a maternity unit. People have so many positive stories about the NHS.
I've got nothing but good to say, personally.
Yeah, no, I can fully understand why, Gavin.
Very quickly for me.
OK, well, let's get a sense now of the pressure on NHS staff and the reason that they have launched this industrial action. Paul Turner, paramedic for the North West Ambulance Service. He's also a Deputy Branch Secretary at the GMB Union. Paul, that's just one of the many positive stories we're getting here at Sky News today on our Your Say programme. People value the NHS and a lot of people say you can't put a price on, saving lives, but actually you can when it comes to paying staff properly and enabling them to work in better conditions all round. The NHS, the staffing needs investment. That's why you're striking.
Yeah, so the strikes are based on 2 elements. The first element is about the public safety, and the second part is about the 10 years of austerity faced by NHS workers. And I appreciate we are not the only ones on strike, but I can only talk about the NHS because that's what I work for, that's what I'm interested in. And, we miss other very important services out there that are not eligible for strike. But again, from this government, we're awarded pretty much nothing as a pay rise because gas, electric, mortgage rates, rent rates, they all go up, but our wages never match inflation. Now, I'm not saying we deserve an inflation-busting pay rise, but it needs to at least match inflation because of the 10-year austerity that we've experienced. I listened to Vincent, the first gentleman that was on, and I don't agree with what he's saying. There's no right time to take a strike. Nobody in the NHS ever wants to go on strike. We're here to look after the patients that we serve But every single day when we're trying to do that, because of the underfunding and the lack of resources we've got, we are failing every single day. And now it's come to a point where enough is enough, and NHS staff can't carry the burden any longer. People are waiting hours and hours for ambulances, which is not acceptable. There's often, when I'm at work, my colleagues are at work right across the UK, where we're hearing our radios pinging saying there's category 1 emergencies outstanding, whilst we're stood outside corridors or in a completely different area to where we should be. It's not unusual for me to travel an hour and a half to an incident on blue lights and sirens to get to someone who needs us, because there's no resources available in that area. And that's because of the amount of under-resourcing that we're facing. You know, it's really stressful at the moment in the NHS. You know, you don't get a break from it. Your 12-hour shift or your 8-hour shift can turn into 14, 15 hours easily. You're lucky if you get anything to eat or drink during your shift because you stood on corridors. And that poor patient, when you've gone home, is still sat potentially on that corridor or in your cold ambulance. And you come back in the following shift and the patient's still there because they've not moved. That is not acceptable at all moving forward. I hear people saying there's no money for, you know, pay rises, things like that. But we managed to find money for MP expenses, for instance. They claim more in expenses that the 999 callers get paid working for the NHS, taking those 999 calls. It's just outrageous that we're carrying on in the way we are. And now we are struggling to recruit into those areas because other service providers, other jobs are paying more than what you can working for the NHS, which fair play to them because they're looking after their workers. And yes, people could say, well, leave the job. If you don't want to do it, go and work there. But then who's going to do the job that I do? And one of the other things that really frustrates people is how degrading it is being called an ambulance driver. I'm a highly educated medical professional. I've done 3 years at university to obtain a degree, like all of my colleagues have. And even our EMTs and dispatchers and call takers and everybody else across the NHS, you now need to have minimum qualifications to be eligible for those roles. So to be called ambulance drivers, I think it's a bit of a kick in the teeth, and that's coming directly from the government.
Yeah, Paul, I can sense the frustration in your voice. You know, you're living and breathing this, and you know, a phrase that I heard earlier this week. You know, people aren't dying because NHS workers are striking. NHS workers are striking because people are dying. Is what you're talking about?
Yeah, that's correct. A recent GMB survey, our members believe that patients are now dying because of the delays. That's not me saying that. That's, you know, 20,000 GMB members across the ambulance service saying that. You know, we are facing this every single day. And, you know, I don't want to be on strike. Every day I'm on strike, I lose pay, and rightly so, because I'm not providing that service. However, I will never get that money back. And rightly so, I won't get that money back. But I'm doing it because otherwise my children won't have an NHS because it won't be here. We cannot get staff. We are massively underfunded and massively under-resourced. And I'm not going to get onto how badly we're treated through the COVID pandemic. We didn't even have suitable PPE, which again, we're wasting millions and millions of pounds a year storing it out of date in a warehouse.
Paul,
It's just unreal.
Paul, do you have to remind yourself why you still do this job? Why do you still do it?
I do the job because I love helping patients. There's nothing better than saving someone's life, you know, delivering a child, you know, preventing that potential death when you get there. There's nothing more rewarding than that. And that side of the job I absolutely love, and that's why I continue to do it. But the politics behind it, it's just, we've had enough. I cannot stress it. Our members have had enough. I've had enough. People are leaving in droves. We cannot recruit because you can work elsewhere and get more money or the equivalent. For less stress, it's all the stress that you take home with you. You go home after 12, 14, 15 hours knowing that that patient's still going to be sat there in the morning. It's just not fair and it's not right. And I, again, listened to Vincent about giving Rishi Sunak a chance. No, we've had a Tory government now for too long. We need a change. Not very political, to be fair. Not really interested who gets there, but we need to have a change. We need somebody in power that actually cares about the public.
Paul, thank you. Stay with us for just a moment. A really impassioned conversation there with Paul. We can just feel your passion for the NHS service and your frustration about what you're going through. As you said, you studied for 3 years to do this job to save people's lives, and you're not able to do your job properly. Let's speak to Jason in Newcastle now. Jason was in a motorbike accident and spent 5 months in an NHS hospital. Jason, what was your experience in that hospital? Because what I can see from the notes my producer has given me, you feel like a lot of money and time is wasted in hospitals.
I would have to agree with you there, Sarah. Like I say, I was there for just over 5 months in hospital, and I was between 2 hospitals. So I was initially airlifted to a Scottish hospital where they carried out the surgery and things like that. And then I was transferred to an English hospital to be repatriated closer to home. Now, the first thing that comes to mind anyway is the fact that it was cheaper to use a private ambulance than what it was to use an NHS ambulance, which I thought was staggering. So that was out sort of straight away. Now, when I was in the English hospital, the hospital, I would say, a lot of wasted money. Now, I'm from a timber frame background in the private sector, where things was basically a production line, and you had to work for what you had to get. Now, in the NHS, that I'm led to believe anyway from staff when I was in hospital, that when you take a day off from work, you're actually paid for the day off from work, and you just don't receive your shift enhancements. Whereas in a regular job, you would lose your first 3 days and things like that. So there would be a waste of money for me anyway. So you'd be paid everything by your shift enhancement for going to work, but you don't actually turn up. There was ward managers and things like that which were taken, from what I believe anyway, from my research. So they were like grade 7 or band 7 or band 8. £43,000 a year plus, walking around. I don't know what their situation was, but they were basically tearing pennies off, using PPE and things like that, walking around asking patients how they were doing, then tearing it off again and putting it in the bin, and then carrying on walking around. I was thinking to myself, right, well, I don't understand what your purpose is exactly within the hospital, so I don't see why you'd be paying £43,000 a year for you to be doing what you're doing. I don't really understand with that. I ended up having a few meetings with the ward manager on my particular ward about how staff were behaving, how, for instance, there would be 4 sisters on a ward, 2 nurses and, say, for instance, 3 carers to look after the patients. Now, on my ward, it wasn't a particularly busy ward, so I can't speak for the whole hospital. I've got no doubt that in other wards, things are really busy. Like what a previous gentleman was saying about the stroke ward, I've got no doubt that it's a really busy ward. But on the ward that I was on, you couldn't get staff for love nor money through Monday to Friday. But yet when it came to a weekend when there was enhancements, so time and a half rates of pay and double times for a Sunday, you couldn't get moved for nurses on the ward, So I've got to think to myself, there's another amount of money that doesn't need to be spent.
OK, Jason, well, what you're talking about is accountability, and you did the right thing. You asked questions. You asked to speak to the ward manager about what you were seeing, and that's probably a good example to set in terms of asking questions, whether it's about your care or the environment you're in within the NHS. Let's quickly speak to Anthony from Chessington, who's been hanging on. Anthony, I'm really sorry to hear you had a seizure 2 weeks ago, and your ambulance wait went from 2 to 9 hours, so you went back to bed and woke up with concerns over a cardiac arrest. What happened?
Basically, what happened is I had a seizure, and I was in the hallway, and I had a seizure in the hallway, and my wife had to call for the ambulance, and then basically he's waited for quite a while for the ambulance to come out. And when they came out after quite a while, they came and did tests on me and said, yes, basically your symptoms of having a heart attack. And they took me to hospital, and I was still waiting in the ambulance for quite a while because the lift on the back of the ambulance stopped working, and I was stuck in the ambulance for quite a while as well. And when the people came and said, we can't take you out of the bed in case you do have a cardiac arrest, you're going to have to wait in the ambulance. And then when I got into the hospital, I was waiting for 5 hours before even anybody come and did any checks on me, anything, basically.
Anthony, it must have been an extremely worrying time for you and your family. I'm just going to bring in Paul Turner as well, from the North West Ambulance Service, a paramedic, a GMB Union Deputy Branch Secretary. I mean, Paul, these stories will not be unfamiliar to you. You know, you experience them day in, day out. And I appreciate you staying with us because I know you've got to go and do the school run because, you know, you work and you have a family. Talk to me about how all of this is affecting you personally, because, you know, we talk about pay and conditions. This is your work life. But, you know, how much is it affecting your day-to-day life, your personal life?
It's very difficult. It affects all of my colleagues exactly the same. You know, you can't really arrange anything after work. So if you know, due to finish at 7 o'clock in an evening and you've got to get your children, you know, our partners might work night shifts because we're on days, so you're working opposite. You can't guarantee you're going to be home at 7 o'clock because you might then be stood in the hospital for another 4 or 5 hours. So it becomes a lot of stressfulness that shouldn't really be there. Listening to those poor individuals there that have experienced such bad care by the NHS, not the staff, but because of the under-resourcing, it is just not acceptable. It really isn't. And, you know, I put hand on heart tell you now, none of the NHS staff want to be on strike. We really don't. We want the government to get round the table, give us a plan of how the NHS is going to look in 2 or 5 years' time, and also talk about pay. We need to understand what the government are going to do moving forward. It cannot carry on like this. And I fundamentally believe that we are privatising the NHS through the back door. I know every single day we put out private ambulances every day responding to our calls because we don't have enough staff. We don't have enough people there. So they have to bring in private providers.
Paul, we have to leave it there and you have to go. Thank you so much for talking to us about your experiences.